Yes, I am Jordi Diaz-Manera. I am an adult neurologist by training. I did my training in Barcelona in Spain, and I practiced there more than 20 years. And now I am professor of neuromuscular diseases at Newcastle University in the northeast of England, where I continue seeing patients, and I work mainly in genetic myopathies, neuromuscular disorders, Pompe disease. So here the main aim of gene therapies is to bring back a healthy copy of the gene to the cells that are lacking it. Okay, in this case, the trial is trying to bring a copy of the GA gene, which is the gene that is encoding the protein, to the muscle fibers and to the heart. So the study has, it's what we call a phase 1 study that is mainly based in trying to see safety, but it's also, of course, exploring other measures that are more efficacy, either on the biochemical point of view, so showing that there is an increase of the protein, but also on the clinical point of view, showing that there are changes in the muscle function test, in the respiratory parameters, etc. So what I have presented today is the results of the first 4 patients that have been treated, and the results are showing that the treatment is safe. Most of the adverse effects that have been observed are mild and not necessarily related with the disease, but one of the patients has developed what we call a severe adverse effect, which is a sensory polyneuropathy, and for this reason the study was put on hold by the FDA last year. The patient has improved during this period of time, and with the data that the company has presented to the FDA, that is now the study is again active, and that was put on hold. So, and what results do we have in terms of efficacy? So we have results in terms of GA activity, so the activity of the enzyme that has increased mildly to moderate in the muscles of some of the patients, and also we have results in muscle function that are showing stability of the patients over time, even though most of the patients, the 3 out of the 4 that were infused, stop the treatment. So these are patients that have stopped the standard for care treatment, enzymatic replacement, and after a range of 20 to 50 weeks of follow-up, they are still stable, and they are also improving some scales, especially the fatigue scale. So in summary, it seems that the treatment is going to continue now that it's open again for recruitment. The data on safety that we have are positive, and especially we are starting to see good results in terms of efficacy.